Hello and welcome to Lorbek Luxury Cars. I'm Harry and on this edition of the Friday Drive, again, we're doing something a little bit different. And that's because this month is Breast Cancer Awareness Month. So we're going out to Richmond to visit Dr. Chantel Thornton to find out a little bit more about Breast Cancer Awareness Month and the impact COVID's had on general screening and all of that. Now, to do this, I thought I'd try and find a pink car, but turns out we don't have one. And secondly, I don't really want to look like Lady Penelope. So instead, I got the next closest thing to a pink car, a red car, more specifically, the 2020 Ferrari Portofino. Now, we've already done a Friday drive on one of these, so just flick down through the menu somewhere and you'll be able to see it. It's a very good car, I'm quite a fan of it. But anyway, back to the case at hand. Let's head out to Richmond and meet Dr. Chantel Thornton. Hello, Chantel.
Hello, Harry. Welcome to Specialist Breast Cancer Surgery and Specialist Cosmetic Centre. Come on in.
Thank you. I get to walk through the pink door.
Harry, thank you for coming to visit me today.
It's my absolute pleasure.
It is October, Breast Cancer Awareness Month. So today I thought it'd be really interesting to show you an installation in my room that I have made by Jacqueline Gregory, a Victorian artist. And what this represents is that breasts come in all different shapes and sizes. And so when patients come to see me, I really need them to understand that normal breasts are asymmetrical, and if they have breast cancer, we can't always make the breast absolutely perfectly symmetrical. And we try to do that, but we can't necessarily make it perfect. And also, this gives me an opportunity to show women that breasts are different sizes and different shapes, and that they need to understand and be aware of what shape and size their breasts are. And really that's what October's about. It's about women understanding their own breasts, being aware of them if they have a change, seeing their doctor, and undergoing a mammogram or a breast screen.
So I guess the question I've got is, what's the number one symptom, I guess, that people generally ignore or should be really looking out for?
Well, in Australia, Harry, generally speaking, people that are presenting with breast cancer pre-COVID were totally asymptomatic. So 70% of ladies were having their breast screen, their annual or biannual, twice yearly mammogram, and then they were finding a very small breast cancer. And that's a stage that we want to find breast cancer, that small, impalpable breast cancers that you can't feel. Unfortunately, because screening has dropped for the month of April 2020 in Australia by up to 98%, many women will be presenting late with breast cancer diagnoses, and those breast cancers may not in fact be curable and may be requiring many extra treatments. So what I would say to women is that they need to be able to look at their breasts in a mirror in a well-lit room, keeping their hair back if they've got longer hair like me, exposing their collarbones or their clavicles all the way down to the inframammary region, and really looking at their breasts with their hands on their hips, with their hands contracted, their pectoralis muscle contracted, and then raising or elevating their hands above their heads, because what we need to look for is the contour of the breast, the shape of the breast. So we're looking to see whether or not when we lift up our arm there is any pulling or tethering of the skin, is there any blunting of the contour, anything that could indicate that there's a mass inside the breast. And so I think it's really important for ladies to visually inspect their breasts, because most people think breast cancer presents as a lump, and it does not necessarily present as a lump. It could be a thickening in the breast, it could be a nipple discharge, a single spontaneous ductal discharge. It could be a change in the nipple, so like an eczema or a rash on the nipple. There are a variety of things that can present like breast cancer that are not lumps. And so I think it is important for women to be aware of what their normal breast feels like.
So I guess what you're saying is by the time they might discover something, it could often be too late. So I guess...
Well, I mean, it's never too late with breast cancer, I would say, because, I mean, fortunately, breast cancer has excellent survival statistics in the order of 94% for all ladies that present.
That'd be dependent on getting to it early. So I guess the question a lot of people at the moment would be thinking is it safe to visit a hospital to get a mammogram? Is it safe to be going out? Is it worth the risk?
Yeah, it's entirely safe, Harry, to have a mammogram and ultrasound. If your doctor has recalled you to get a mammogram or an ultrasound, if you're part of a specialist breast cancer centre like we have here, please don't ignore it. Please go in and get your imaging. It is entirely safe. Within the consulting room now, we are doing a lot of telehealth, so we're trying to keep the consulting room free, particularly for our immunocompromised patients that are having chemotherapy. But please do not neglect any of your cancer screening, because we are extremely concerned that ladies will be presenting very late with breast cancer. We currently have 55 women diagnosed with breast cancer a day in Australia, and we're worried that those numbers will be reducing because women are not presenting, and when they do present, they will have, for example, large tumours. They will be more likely to require mastectomies rather than more simple wide local excisions. They may also require to get their lymph nodes removed, which increases the risk of lymphedema. They may more likely need chemotherapy or more excessive and prolonged durations of radiotherapy, and certainly their survival statistics will reduce the larger the size of the cancer.
So I guess if you're concerned about people in your family who are concerned about everything that's going on with COVID, what do you think are the steps they should take to encourage them to not just look in terms of breast cancer, but also their more general health?
I think people need to keep in contact with their primary care physician, so their general practitioner, and most GPs now are offering consultations to patients, be that either face-to-face or telehealth. I think if you do have any worrying or concerning symptoms, you just need to call your GP and make an appointment to see your GP. GPs in Australia are open for business. Breast cancer specialists in Australia are open for business also, and we don't want people presenting late with medical problems. And particularly in our society, Harry, mental health is becoming something that is really important. And so GPs are overrun with patients at the moment who are going through difficult times, and so we need to remember that a person's mindset and their mental health and their mood can impact heavily on other diseases, particularly cancer. And so we do need to make sure that we are looking at the patient in a very holistic approach.
And what's the best way, I guess, what's the best thing the general population can do to bring awareness and actually contribute in a way that's meaningful to, Breast Cancer Awareness Month? I mean, you're on the front line, you see where the shortfalls are in what people are doing, and I guess what the industry might be doing as well. So what's the biggest thing that people can do to make an impact?
I think first and foremost, if you're over age of 40 and you haven't had a mammogram, you should have one. I think if you have any breast symptoms, you should see your GP. I think you should know your family history, whether or not there are any features of or family members with breast or ovarian cancer in your family. It's important for women to know and understand their breast density. So if they do have very dense breasts, know that mammography may not be as accurate for them. Make sure that if they are having a mammogram, it's done with 3D tomosynthesis, which is a 3D type image of the breast. And then overall, I think that as a society, we need to be healthier. So we need to be looking at our diet, 5 servings of vegetables a day, 2 of fruit, alcohol, reducing our alcohol intake, getting some exercise, 150 minutes of aerobic exercise per day and 90 per week, and 90. Yeah, that's right. I'll just do that myself, though. Or 90 minutes of core abdominal work added to the 150 minutes of aerobic exercise. We are, as a country, overweight. We are sedentary. We have many lifestyle-related diseases: diabetes, heart disease, hypertension, stroke, cancers of all types. Stop smoking. If you smoke cigarettes, the best thing you can do for your health is stop cigarette smoking. This is not rocket science, Harry. More people in Australia die of heart disease than they do cancer. And it's all lifestyle related, and much of what we do with cancer management is lifestyle related. So I think that you need to encourage the members of your family to look at their lifestyle first, and then to, if they've got medical issues, to address those, and thirdly, to get your screening, be that bowel, breast, prostate, whatever that is.
Excellent. Well, thank you so much for your time and your insight. I know you're extremely busy, so I'll need to get out of your hair, but thanks for bringing awareness to, I guess, the Lorbek luxury cars community for what is such an important cause.
Thank you very much, Harry. And don't forget to have your mammogram, be breast aware, and thank you for bringing my new car, Harry.
Yes, I know, how exciting. No one's going to miss you with that.
No.
Well, there you have it. And I think what's plain to see is that at no point, even with COVID, we should take our health for granted. So if you have any symptoms, or even if you don't, make sure you get screened and make sure you get checked up regularly. And as always, we'll see you next week.